All right, we are going to talk through how to change a peritoneal dialysis catheter dressing. First, you're going to gather your supplies. So you will need a sterile dressing change kit, clean gloves, cotton tip applicators, sterile pink saline squirts, 2x2 gauze, Tegaderm, and a helper. So first you're going to gather those supplies. Make sure that your door or curtains are closed around the patient's area. You're going to cleanse your work surface with Cavi wipes or the hospital approved cleaning wipes and allow it to dry. You're going to open your dressing change kit, apply hats and masks to whoever is in the room. You may need to grab more if not enough are in the kit. Then off to the side, open your cotton applicator tips and you're going to squirt the saline inside so that way the tips are moistened. And next you will open up your gauze and moisten the gauze. Next you will have on just regular clean gloves and you are going to start by removing the dressing. You will then discard the dressing and your gloves away from your sterile, clean area. Next, you will perform hand hygiene. Open up your sterile kit and apply the sterile gloves. You will put the remainder of your supplies on your sterile field, the gauze and the Tegaderm. Okay, then your helper will grab the Q-tips and with your sterile gloves you will pull them out, the pre-moistened Q-tips, and you are going to clean around the site starting at the insertion site outward. So you will never go back towards the insertion site. Next, you will grab your gauze that is also pre-moistened, and you will cleanse the tubing, the catheter tubing. Same process, starting from the insertion site and working your way out, never going back towards the insertion site. You can use the sterile drape that is included in your sterile cap change kit to help hold the line so that way you remain sterile. Next, you will let it air dry. You can use additional Q-tips to help dry if needed. Then once dry, you will loop or coil the external part of the catheter to help prevent tension. You will then cover the site with your 2x2 gauze that you placed on your sterile field. And then cover the insertion site with your Tegaderm. You'll then remove the outer layer. You will date, time, and initial the dressing with the pieces provided. Those pieces will also help secure the catheter outside of the dressing. You can use additional Tegaderm or tape if needed as well. Once complete, you will document in Epic the dressing change and the site assessment, and you are complete.